As an emergency physician in Edmonton, Louis Franciscuti has seen a lot of frostbite injuries. It's a crisis that returns every year.
About 2, 3 weeks ago, I saw two patients that had infected amputation sites from last year's frostbite. So in other words, we were still dealing with frostbite from a year ago, and now these men and women are still homeless, and chances are they're going to re-injure themselves again.
And frostbite amputations have increased in Edmonton for the second year in a row, according to Alberta Health Services data obtained by CBC News. That data shows 113 amputations related to frostbite were performed between April 2024 and March 2025, more than 5 times the number recorded during the same time period in 2019-2020 before the pandemic hit. The number of frostbite diagnoses in Edmonton's emergency departments last winter also jumped, from nearly 900 to more than 1,300, the most Edmonton has seen since at least 2011. In both data sets, more than half of the patients were recorded as unhoused.
It absolutely impacts quality of life. It impacts future prospects for careers and jobs, and the ability of people outside to be able to move around and provide for themselves. So it is, it's heartbreaking to see, and we see it too much.
Dax says that the increasing numbers show that more resources are needed to help protect and support vulnerable Edmontonians, especially during winter. The City of Edmonton has an emergency weather response that provides additional shelter space and supports for vulnerable people. But it only activates if temperatures are forecast to be below -20 for 3 consecutive days. Advocates say the threshold is far too strict, and that frostbite can happen well before -20.
I'm standing here right now, it's very cold, and I'm not sure the temperature, but it feels like it's probably about -6 with a wind chill, maybe -10. If I was out here for an hour, I would be having frostbite without any coverage on my extremities.
And time becomes critical after frostbite sets in.
If it's been within the last 72 hours, it hasn't gone through a freeze, thaw, freeze again cycle, then that gives us some treatment options. If it's been longer than that, then our treatment options are really limited.
The risk of amputation drops dramatically if someone has a safe place to stay after frostbite treatment. That's where the Bridge Healing Program comes in, providing temporary shelter for unhoused patients when they're discharged from the ER.
Bridge Healing is designed quite simply to ask patients that are experiencing homelessness, do you want a chance to start your life again?
The program currently has 48 spaces, and Franciscuti hopes it can expand across the city. But with more than 4,000 Edmontonians experiencing homelessness, advocates say more support is needed. The City of Edmonton says help is needed from all orders of government, frontline organizations, and communities to make real change. As for this winter, there will be no changes to Edmonton's cold weather response. The city says the policy is being reviewed, but will remain in effect until at least mid-2026. Taylor Lambert, CBC News, Edmonton.